Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who treats knee pain frequently, and as a martial artist who's had knee injuries and knee pain, this particular study just reinforces what I continue to promote in my office. And the first thing we need to say is that surgery, we generally don't do placebo surgeries because you don't want to cut somebody and just to see if cutting somebody but not doing surgery, not actually changing anything, is any different than actually doing the surgery. But we did, the military actually did the first placebo surgery on knee meniscal tears, or it was debridement, one of the two. I think it was debridement, quite a few years ago, and they found that after a year, there really wasn't much of a difference. That started it. We've now seen studies on both degenerative, so debridement, so cleaning out the knee. We've seen studies on traumatic meniscal tears and on degenerative meniscal tears, where a year later, there really isn't a difference between the surgery and the group that didn't have surgery. And I have seen lots of patients who thought they were headed for surgery, and it turns out that they didn't need surgery, myself included. A couple years ago, I had suffered a meniscal tear, did not have an imaging, but all of the orthopedic tests and the pain and everything fit. So I worked on the knee, made sure it was functional, and just understood that it was going to take some time for that to fully heal. And now, even about a year or so later, now I look back, I can't even remember which knee it was. I think it was on my left, but for a long time I couldn't kneel and bend back, but I can do that now without an issue at all. But the important thing is to make sure that you're doing some type of therapy on that. And for me, I'm waving around this metal device. We use instrument-assisted soft tissue technique, in particular Graston, but I really think those types of techniques, as well as exercise, not necessarily exercises, but exercising. I think the worst thing you can do for any condition is to sit on your duff and not do anything. So if we can get all of the tissues around the knee functional and moving the way they're supposed to, and somebody is moving, exercising, the outcomes are going to be good. So this particular study looked at 278 patients, and it followed them for 5 years. So we're not just looking at the 1 year mark, we're looking at the 5 year mark. Average age was between 45 and 70, and they found that there was very little difference between the surgery and 16 sessions of rehab done on those patients. A couple things to consider. 32% of those patients did have surgery in the first year, and I'm going to talk about that in just a second. But basically in 5 years, there was no difference in the outcomes and how patients felt as far as their knee was. And that had to do with degenerative changes, so not traumatic changes. So in what particular scenarios do I think that surgery probably is more likely? First of all, if the meniscus tears and flips over and locks, that becomes, there are some times and procedures that might work, but in general, those are the ones that are probably going to need surgery. And if there's quite a bit of arthritis in there and the degenerative tear is just on top of everything else, then you're more likely to end up needing surgery. And if we're morbidly obese, that extra weight just is too hard to rehab outside of that. But short of those, almost every knee meniscal tear, whether it's degenerative or traumatic, should absolutely go through a course of conservative care that does not involve surgery. And I would suggest that my biased opinion is it should absolutely have somebody who is treating the soft tissues around the knee, not just exercise. As a matter of fact, if I had tools and I only had the soft tissue treatment versus the exercise, I would take the soft tissue treatment any day of the week to get better outcomes. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.